Dear overwhelmed and scared nursing or NP student, this one's for you. So on a recent Q&A, someone asked me that if I could go back, knowing what I know now about how things would be, how I would feel in this moment, would I still have become a nurse? Would I have gone on to be a nurse practitioner? This person in the Q&A, they were in nursing school and they were scared because healthcare is so incredibly unhappy right now. And the messages they see everywhere demonstrate exactly that. And I have to imagine that it would feel insanely difficult as a student to see that all the time, everywhere on social media, everywhere you look, people are just frustrated. All of the people in your future profession are just expressing honestly how miserable they are, like all the time. And I know that I've personally been a part of this immense narration of just frustration because I am so frustrated and so burnt out with healthcare at this point. But that's my story. It's not everyone's story, and it very well might not be yours. So my dear frightened nursing student, let me tell you why I'm so frustrated. But even with all of that frustration and anger, why I might still go back and do it all again. All right. So how did I answer that question? Would I go back and do it all over again if I knew what I did now? And I said I don't know. And that's because I honestly, I do not know. I don't know if I would ever want to not learn what I've learned from this profession. I went into nursing school as a very naive, sheltered human who thought I had life figured out and that I had people figured out. And I am nowhere near done with my career, but a decade later, I am a completely different human, a much more compassionate, much more understanding, less judgmental person. And those things are great. I love that about me now. I've also become angry, though, as I've realized how unfair our healthcare system is and how many people suffer from being unable to access appropriate care without going bankrupt. And I don't have a good spot to put that anger yet, except on social media. And I feel like other people feel the same. That's why you see a lot of that frustration. So I feel overwhelmed and I feel burnt out because I don't have anywhere for that emotion to go. So I wanted to kind of give you a pros and a cons list going. Should we do that and just kind of give you a narrated walkthrough of what's been going on in my mind since this person asked me this question, because it's just been rolling around in my head for days. And because this is nursing, this can be counted as an educational video. We'll have an objective to this chat to make it official and everything. So my goal here isn't to tell you that it's going to be absolutely fine when you become a nurse, because I think that you're well aware at this point that it might not be. You might not like it. Some jobs are just crappy, and I will never ever lie about the reality of this profession or tell you that it's all rainbows and butterflies and you can run around in cute scrubs and a fancy car and tell the whole hospital exactly what to do, just to get you excited and in the door so that you can fill my spot. And it's not to scare you away either. I believe that just like when we educate our patients on the options they have and what the risks and the benefits are, we should have that with our future jobs as well. Weigh the risks and the benefits and adjust the plan accordingly, because you can always change your mind whenever, and don't let anyone ever tell you otherwise. So let's start with some irreplaceable things that nursing has given me that came to mind as I thought all of this over. One of the coolest parts of being a nurse and an NP is how you are allowed into people's most private life moments, showing brand new parents of their hours-old baby how that little tiny human, even though they're covered in wires and tubes, this baby is the most beautiful, miraculous thing, and helping them feel comfortable doing care tasks for the baby and just showing them the general lay of the land. Being the primary nurse for a family who came onto the unit absolutely terrified with their child's new diagnosis, not even knowing how to pull up meds out of a bottle in a syringe, and teaching them every single day until they can swap out a trach quicker than you can. You can operate a complex med regimen like they've been doing it their whole lives, and they've learned to advocate for that child like a professional. And you had a hand in that because you were kind of there helping guide them. I have caught early signs of decompensation and intervened before the patient fully deteriorated, and then was able to help discharge them home a few days later, and just receiving so many hugs and words of gratitude to the wife who thought that she might never be able to see him go home and lay in his favorite recliner at home again. I've been able to tell a child and their family the life-saving news that it's happening. After all this time, you're getting a heart transplant. They've been in the hospital for months, and this is just life-changing for them. They're so excited. I have calmed so many fears and clarified innumerable concepts for patients that they just didn't understand about their healthcare. Maybe they went to a specialist and they just didn't understand what they were saying, and you can translate it. I've relieved pain, nausea, loneliness, overwhelm by being a calming presence at someone's bedside and kind of leading the way in terms of like, I can't fix everything, but I can fix this. I've painted toes, I've done hair to make people feel like themselves again, and I've worked with some of the most amazing humans in the world on healthcare teams who just want to see people like live and live well. I have been able to sit with patients through the depths of their depression and work with them for months, seeing them in my office month after month after month until they finally start seeing life's colors again. And my office is decorated, or it was, with cards and handmade crafts and paintings and so many signs of appreciation from my patients who felt heard somewhere along the line and cared for by things I was able to do with them. I have explained how the body works to so many people, and while not all of them really care, some do. And with those that do, we've been able to come up with lifestyle plans and med regimens, and they get better, and their quality of life improves. And then they send you pictures of them on hikes in countries with messages that, like, you got me here. Without you, I wouldn't be here. And it's just the best feeling ever. I have gotten to be part of so many good deaths. I've learned that there are good deaths by creating a peaceful environment as possible for both the patient and the family as they pass. And I have been able to empower so many of my patients to make choices about their own end-of-life care while they are still well, and have received tearful phone calls years later sometimes from a spouse saying that they are so grateful that we had had those uncomfortable conversations because their spouse has now passed away. But they didn't have any doubt. They knew exactly what that person wanted and in that situation, and that made that impossible time a little bit easier. I've learned that education level has absolutely nothing to do with your intelligence. And with some of the smartest people, they have the least amount of education. I've learned that beneath outwardly struggling people, there's almost always individuals who do not feel heard. And that is something that I can't independently solve, but I can slowly improve relationships one conversation at a time. I will never, ever forget the smiles of the patients and families who you were able to help recover from critical illness, and just knowing like, oh, I played a part in that. One woman who will stick in my mind forever, she was on our floor for like 4 months, and even though she had no appetite due to her condition, she always ordered on her meal tray my favorite chocolate cake every night. And then if I had time, I would sit in her room and I would eat it, and we would chat about like anything and everything. And that is one of my fondest memories from healthcare. I have learned about my patients over the years, and that they're so wonderfully different, and that their treatment should be too, because people are not one size fits all things. And I've learned to fight for that with my patients in a healthcare system that does not agree. And I've been able to meet so many incredible humans. And I like to think that hopefully I've helped some too along the way. Being a nurse and being a nurse practitioner has showed me how many awesome people there are out there in the world. And the problem, honestly, here is that I like most of them. And I want to help them. And the more I got to know them, the more I was invested in making sure that they got what they needed, because I realized that they as humans were so valuable and deserving of care, but our healthcare system does not agree. And here we kind of can turn to see why I maybe would rather have not gone down this path at all. Because I've sat with patients as they ask me how many years sooner they will likely die if they stretch their insulin like they're doing because they can't afford it. I have quietly retraced my steps out of a room after entering and accidentally barging in on 2 parents who were overwhelmed with the reality that their child has a lifelong health condition that will require constant care and medical treatment, and they don't know how they're going to pay their $13,000 annual deductible this year and every year after that. I have battled with insurance companies thousands of times and been told that, yes, we know it's the best treatment, but we just don't cover it. It's expensive. Why don't you try this? Oh, you already did and it didn't work? How about you try again? Have you tried it at your office so that you can document that you tried it? And then if that does fail, we have to try these other 2 meds that we know won't work, but we need to record it so that when we do maybe approve it, they can have it, but that's only after they hit their deductible. And I realized most of the time isn't going into like spending time with patients like I thought it would be. It's about documenting, whether I was a nurse or an NP, so I don't get sued. And I'm writing these novels in the care plans about how I can't do the recommended treatment because the patient can't afford it or the insurance won't cover it. So I'm not medically neglecting the patient by not recommending it. I just can't do it. I've been screamed at by more patients than I can even begin to count, telling me that I'm a murderer for recommending the COVID vaccine, and their rage and their yelling increase when I request they wear a mask in my office during the pandemic to protect myself and other patients. And then I'll get phone calls a month or two later, and they're short of breath, they're coughing, and they were just diagnosed at COVID, and they're swearing at me when I say, I cannot do anything at this point. You are going to need to go to the ER. And they'll demand, why didn't you tell me? Why didn't you do this for me? Why won't you treat me? As if anyone in healthcare went into this to actively harm people. I've had to tell people they have cancer and make phone calls to loved ones from the hospital, letting them know that they need to come to the hospital and they need to come now if they want to see their loved one alive once again. I have been chased down hallways by angry patients as they swing IV poles at me with the intent of harming me. I have performed CPR on so many people, and most of them never ever recover from that. I have held babies of young parents as the wife or the husband scream as they're watching people frantically trying to save their partner's life, and they ultimately don't succeed. I've walked in on family members who were using their own syringes to remove IV morphine from their dying parents' morphine pump, and had to kind of make the call about whether to pretend I didn't see anything at all and let the parent have the comfort of their child's presence while they pass away. Or do I, enable this, like let it go and enable this obviously harmful activity? I will never, ever forget the sounds that parents make when their children die. Or the fact that people will come out from the room next door and complain about those sounds because they're trying to sleep and their kid needs to sleep. I hate working holidays, and I'm really grumpy whenever I had to work weekends. I probably got fewer than 20 interrupted 20-minute lunch breaks in like 9 years, for real. More times than I would have loved. I got mandated to stay for an extra 4 hours after already working 12, and I could barely think straight while I was taking care of human lives, and that's scary. I've had assignments that were so beyond unsafe because we just didn't have the staff. We didn't have the staff that we needed. And I've stayed up way too late dozens of times looking for therapies for patients who desperately need to go to a specialist like a cardiologist, but they cannot afford it. And they've asked me to try to find something because something is better than nothing. I've had people threaten to shoot me for declining them their requests because they think it's, that it's just a shop you walk in and you get what you want. And I've come to expect being yelled at daily. I have lost so much sleep wondering if my actions had been different, would the outcome of that patient's case have been different as well? And I struggle knowing that will always remain unanswered. And I have felt so overwhelmed working as an imperfect human in a system that requires perfection and sues you if you make a mistake, which you will do because you are not perfect. So do you see how all of this is hard? How there are so many beautiful and rewarding pieces of this, and there are just as many devastating, rage-inducing ones. I love teaching patients about their health and empowering them to make choices that work for them, but I feel absolutely crippled trying to do that in a system we have because nobody can do any of the things I suggest because they can't afford them, or their insurance says no because the most effective therapy is expensive and they don't want to cover it. I wanted to provide excellent nursing care to all of my patients. When I went into it, I was like, I'm just going to be like that nurse that can really change someone's life in their hospital stay. But I had so many patients that there was no way I could do that most of the time. But when I do get to educate and make that impact and make the breakthrough with people, it's so fulfilling. And when you can implement those nursing actions and bring a positive light into someone's darkest day in the hospital, that's the best feeling. So I don't know. I do not know if I would do it again, but I absolutely know I would be a very different person today if I hadn't. And I really don't like the idea of that, which makes me think I probably would do it again. I would certainly be so much less angry and just defeated. But then I think, we probably need angry and defeated people to actually make the change that we need. So to you, nursing or NP students sitting there wondering, how do I know if this is something I pursue when it seems really, really hard and like people are having a bad time? I want you to know it's a difficult career. Some people are going to have a much harder experience than others, just depending on the setting that you end up working in. But with the risk of great difficulty is also going to come the benefit and fulfillment. You can confidently say that every single day you make an important impact on lives. And that is not something everyone can say in their career. Like my husband in IT, a lot of the times he's like, what am I doing? And while many jobs in nursing will not be for you, there are so many options. So it's likely that if you do stay on this path, you will eventually find something you love. And you'll never know if this would have been for you unless you try it. And if you change your mind in a few years, that's okay. You can go down a different path with nursing or change gears entirely. Maybe you'll get super fired up about how crappy our system is and go join the political world fighting for increased access to healthcare. We need your passion to change things, whether it's at the bedside, educating patients in an office, or in forums and activist groups, or if it's your passion is actually doing something totally different, like go do that. So please don't see the frustration of your colleagues and those in the profession as a whole, like, oh, this is a huge turnoff, I don't want to do that, because the system is very broken and has many broken parts, but it also has a lot of beauty in it too. And I know this probably didn't solve any of your internal dilemma, but I hope it gave you some insight into the discussions of why people are saying the things that they are on the internet, why they're bailing left and right. Also know it's been a horrific few years in healthcare. This is a terrible time to be a student. But it won't always be like this. The pandemic will end. And if we all keep educating and talking about what is wrong with our healthcare system, I really do think that it's gonna hit the critical point where we can actually enact change and develop a system that's much more fair. And if you wanna be a part of that process, I so encourage you to at least try, but also know that if it's not for you, there's absolutely no shame in that. And changing your path is not quitting. It's just like recalculating your route. And either way, you will find the best fit for you. And so I recommend following whatever you feel is right. Channel your inner Glennon Doyle and just do your next right thing. I promise you can do this if you want to, if it's right for you. And if you have anything you want to share about if you would do this again, if you're a nurse or an MP, I would love to hear those comments down below just to give people some ideas to bounce off of each other. And all your whys are welcome. Why would you? Why wouldn't you? And I think that's going to lead to some great discussions, and I hope it helps. If you have anything else you would like to see, like on this topic or questions, please let me know and I can do a video about it. And if you want to snag a free nursing report sheet or a soap note, I have a newsletter now and you can sign up for it below. It's just going to be like little tidbits an easy way I can communicate little advice and tidbits and all the things with you if you want to sign up there. All right, friends, I hope this helped. I will see you soon. You can do this. Bye.